You are watching Los Angeles and San Francisco Primetime TV.
您现在收看的是洛杉矶18台、旧金山42台中文电视黄金档。
嗨，大家好，我是罗博士。我们今天很高兴有 Dr. Vu，Dr. Linda Vu，跟我们一起谈 cataract 白内障。今天是要用英文讲，所以要注意听。Dr. Vu, could you tell us what is a cataract?
A cataract, that your eye is very much like a camera. It has a focusing portion in the front as well as film in the back of the eyes, which is called the retina.
Okay.
And everything has to work well in order for you to see. But inside the front of the eye, there is a lens that focuses for you, but over time, it can get cloudy and it can block the light from getting into the retina, making it harder for you to see. And that lens that gets blocked and hazy, that's called a cataract.
What is the cause of cataract?
The natural lens in your eyes is supposed to be clear so that you can see. But as we get older, the proteins inside that lens gets a little bit more opacified and it turns yellow, blocking the light.
Okay.
And so then you have more difficulty seeing, particularly in dim light and at night.
So I imagine looking through a window and the window is not very clear. Is it something like that?
Yes. Depending on the way the proteins change in the eyes, it could be evenly dim. You can have kind of areas where it's a little bit more cloudy and parts which will cause glare in your eyes. And so it will cause different visual symptoms, but it would all lead to making it more difficult for you to see.
Lose its flexibility?
Definitely. And that's an aging change. Most patients they'll notice that loss in flexibility as a loss in that reading vision that we get when we get older, otherwise known as 老花.
Okay.
Okay. Yes. And so the lens will naturally change its shape a little bit to change its focus so that you can see from distance and at near. But as you get older and you lose that flexibility, then you will notice you can't focus up close anymore.
But this is only a problem for older people, right? Do younger people have to be concerned?
It's changes in your natural lens, and typically, you're right, it does happen as you get older. But there are lots of different causes for cataracts. Sometimes they are related to certain medical conditions. Sometimes they're related to certain medications that you're taking. So it is important, if you're having any visual symptoms, for you to get checked because, again, no redness, no pain, and you won't really know that you're having them.
Two questions. We can
Yes.
talk separately. Is it usually genetic? And also about diabetes. If you have diabetes, are you more likely to develop this problem?
Those are good questions. It's an aging change, so a lot of times patients are going to get it anyway, so it's not really hereditary.
Okay.
But what can be hereditary are the types of cataracts that happen a little bit earlier. So if your parent had a cataract when they were in their 40s and 50s, you might be more likely to develop them earlier. If your parents didn't develop them until their 80s, you might not develop them until your 80s. But it's an aging change.
Okay, that's good.
Your second question
About diabetes.
about diabetes. Yes, certain medical conditions can predispose you to forming them sooner, and diabetes is one because diabetes can affect the inside of your eyes, and that can cause you to develop those cataracts sooner. But there are a host of other medical conditions as well that can predispose you to cataracts. So when your medical doctor is treating you for any of those conditions, they'll make sure that you get an eye exam also to screen you for early development cataracts.
Now, to be totally honest, I might have to get an exam for cataracts. I've noticed that driving, sometimes the road signs are a little blurry. I'm a little scared of the exam. Should I be?
You shouldn't be scared for an exam. In fact, getting an exam earlier is probably better because we're in a position to be able to detect conditions sooner. And sooner detection maybe means sooner treatment.
Now, I know people that are taking drops. Is that going to cure me if I just take drops?
There are no drops that have been FDA approved for the treatment of cataracts. And so, although I know some patients will try things, they may not be able to prevent and certainly not treat cataracts.
Now, talking about preventive measures, are there things we can be eating, things we should be doing to help delay that onset?
Cataracts is an aging change, so we certainly can't stop them. But aging. So to delay, I recommend staying in good general health, which means controlling chronic medical conditions, because again, medical conditions can increase your risk of cataracts, but also just staying healthy, which means exercise, eating antioxidants, and in general, to keep your general good health.
It comes to treatment, and we're talking usually surgery. For a chicken like me, what are we looking at? What will the treatment entail?
Well, since this cataract is blocking your view, I'm going to have to take it out. But the good news now is that our technology has taken a big, scary procedure and made it simple. It is for the patient.
That's good. That's good.
It is a less than 20-minute procedure. It's under local anesthetic. You're awake, but patients don't have discomfort. But I do have to take this lens out. But our technology has taken it to a point where I can do it through a micro-incision. The incision is less than 1/10 of an inch.
Oh, wow.
Yes.
Oh, wow.
And so that's why the recovery is very fast for a patient.
So less than 1/10 of an inch, so no sutures.
No sutures.
Oh, wow. It will just heal.
It heals. It heals itself.
Okay.
Once the cataract is out, though, since that cataract is your natural lens, I'm going to have to put in a lens to help focus you better. And the standard lens that we use for cataract surgery will typically have a single focus and will focus you for the distance. But the problem is then focus up close. You're going to have immediate 老花.
Oh, okay, okay.
And so you will need to wear glasses after surgery. And most of our patients, being older, are already having 老花, but there are options even for that.
Oh,
so now we have lens options which we can place in 2 focus for you, or even 3 focus for you. So that you can see far, computer, and your reading without having to wear glasses after surgery.
Oh my goodness. So the lens that is now part of our eye will be able to have the different depth of field.
Yes.
Amazing. One side issue we didn't really cover is insurance. Will that cover the exam, the treatment? How does that work?
The exam and the treatment, yes, is generally covered because cataracts does affect the quality of your vision, so it is considered medically necessary.
That's good news. Very good news. Very good news. Now, how long before people start seeing that improvement that we're talking about?
Even when the patients come back for their first day check the next day, they're already seeing better. And that's when I get my hugs and my tears of joy. And so it makes my job very satisfying.
That's wonderful. And I'm not nearly as nervous as I was before, so we're very happy that you could join us today. Thank you very much, Dr. Vu.
Thank
we
you
will
so
definitely
much.
have you back. I know you all want to hear more about the eye and what we can do to protect our vision and keep that quality of life. So thank you very much.
Thank you for having me.